Hello YouTube, it's Rhonda. Rhonda Bandit 87. That's the username I've chosen for myself. I just wanted to do a quick video and read you guys off the guidelines for success that my surgeon had given me whenever I was pre-op. My surgeon is very involved. He's a wonderful surgeon. Again, his name is Dr. Lewis Fox. He's out of Dallas, Texas. That's where I live. And he's very, like I said, just very involved. His office staff is wonderful. So if you're in the Dallas-Fort Worth area and you're looking for a surgeon, not that I would ever, push anyone to have weight loss surgery, obviously, but just to give you a wonderful recommendation, he's it. And on his website, and I have the packet somewhere, he has guidelines for success, and I would love to read them off to you. So, his number one, 3 meals a day, at set times, you sit down, try to eat as a family, if you have a family. Not everybody, that has weight loss surgery has people that they eat with. Number 2, no snacking between meals. Do not eat when you are not hungry. Seems pretty no-brainer, but I know I've been there. I'm sure we all have. Number 3, eat slowly. Put your fork down between bites, but finish your meal within 20 to 30 minutes. Any longer becomes grazing, which is counterproductive. Number 4, take small bites, nickel to dime size. Sometimes we all fall off that train. I believe that's how how my gain cycle started, getting back up to 185 from 150-ish. Number 5, chew your food thoroughly. Who hasn't gotten stuck whenever they haven't chewed very well? I know I have. I used to get stuck almost every other day for about 6 months. It was really horrible, actually. My fiance, now husband, was even making comments, and he's never commented. He's just always been very supportive. I didn't even tell him until we were dating for almost 3 weeks, and then of course it was a huge deal. I was like, I have something to tell you, and I don't really want to, all those mind games. Number 6, small portions. Use a small plate and small utensils. Always portion out your food. Eat the least amount of food that will satisfy you. Oh, hold on. Oh no, my laptop's about to die. Number 7, eat only good quality nutritious foods. Make healthy food choices. Remember, protein first. At least 50 to 60 grams of protein per day. Alternate 2 to 3 bites of protein with 1 bite of vegetable. The more you cheat, the less weight you will lose. Give me just a moment. Sorry guys, this is only my second video. I'm not very good at figuring out my battery situation just yet. Number 8, stop eating as soon as you feel satisfied. Ask yourself, am I still hungry, before taking the next bite. If you can say, I am no longer hungry, stop eating. Only eat until you're 80% full. This is mandatory. And he capitalized it. He's so cute. That's a great piece of advice. The other day I was eating some shrimp. I made myself 10 shrimp and like 10 maybe about 5 spears of asparagus to go with it. I am trying to only eat the recommended amount, however much that is, for everything. I got all my asparagus in before I had eaten absolutely all of the shrimp. I think I had about 3 left, and I was just kind of like staring those shrimp down, and I said, well, I don't want to waste them. Shrimp are expensive, but I said, I'm satisfied. I don't need them, so I threw them out because I'd reheated them well, no, I didn't reheat them, but I reheated the asparagus. So, you don't always have to clear your plate. There's always been kind of that guilt associated with not eating all your food. After all, there are starving children in Africa, so we all have to clear our plates, correct? No. Okay. Number 9, do not drink while eating. Drink lots of liquids between meals, 6 to 8 glasses per day. Fluid load 20 to 30 minutes before meals. I guess that's to keep us from eating as much. Number 10, avoid fibrous and starchy foods, all breads, flour, corn, tortillas, and cheap calories / fast food. Avoid all greasy, fried, and fatty foods. Avoid carbonation. Pretty self-explanatory. Number 11, limit potatoes, rice, pasta, cheese, milk, and juice. Not hard to do. I mean, I can eat all of these things, but empty calories, like I said, I'm doing Weight Watchers, so I mean, for a potato, or just like a large potato, it's about 6 points, and I only get 28 per day, so that's not happening. Number 12, especially when I can have 10 shrimp for, 3 points, and that fills me up way more. Protein first, always, always, always. Number 12, take a daily multivitamin and calcium supplement. I don't do that, I'm sorry. I just don't need it. I feel like I eat such a wide array. I say I don't need it. I probably do need it, but I have my vitamin levels checked very regularly with my primary care physician, and other than B12, which I supplement, my vitamins are fine. Number 13, incorporate exercise into your daily routine. Don't find the time, make the time. At least 30 minutes a day should be a goal. Consider cross-training, alternate aerobic versus light weights. I am definitely starting to do this. I've started a program, it's a Beachbody training video. It's a T25 with Shanti. I love it. It's only 25 minutes, but it really gets my heart racing. At the end, I'm a sweaty mess. I love it. I do it with my husband. I did the alpha cycle by myself. We've done beta together. We actually just finished it yesterday. We did the last video for the 5th week, Speed 2.0. It's wonderful. It's strange how whenever I was doing the alpha, I didn't want to do it with him, but now that we did the beta together, it's hard for me to imagine exercising without him, so that's cool, awesome. Number 14, keep focused and be self-disciplined. Just because you can doesn't mean you should. I mean, that could equate to any part of our lives, not just food. 15, routine follow-up office visits with your surgeon are required. Like I said, he's very hands-on. I kind of made the mistake of not going in to see him for 2 years. I recently went in, and it's just fueled the fire under my butt. And he said next time he wants to see me in September, I've got an appointment in late September. He says he wants to see me around 150. Like I said in my last video, I'm 166.5 today, so we'll see. That's about a 15-pound loss, and I know I can do it. Number 16, you must return periodically to have your band adjusted. A well-adjusted band will drive your weight loss. Now, this is something that I didn't talk about in my first video. I've actually had 6 fills. My first, through the 5th, it was all 1 cc added, and at 5 cc's, my 5th fill, I reached a good restriction. I was about 190 whenever I got that 5th fill, and everything was great. I was staying full. There wasn't anything I couldn't eat. I'm a big believer in restriction, not actually stopping what you eat, as some people seem to think, but just, satiety. And I worry about staying full and getting fuller off of less food, as opposed to eating more and reaching for something two hours later. I'm all about getting full and staying full for 4 to 5 hours. That's how my band has always worked for me, and it's wonderful. And around that 180 mark, maybe, I just wasn't feeling that same restriction. I was getting fuller, off more food, maybe, a cup and a half, where I want to be, half a cup, 3/4 of a cup. So I went back in and got 0.2 cc's added. and that was in 2012. And like I said, it's 2014. I haven't messed with my fill level since then. I went in very recently to True Results and almost got some fluid removed because I had been getting stuck so often. But I had a good talk with the physician's assistant there, and it turns out I'm just not chewing very well. So I haven't had a stuck episode since the well, since I had my conversation with her, which was last Friday. And I haven't, like I said, I haven't had a stuck episode since then. So it's really helped just to kind of remind myself of the band rules, and do what I need to be doing. Not drinking for 30 minutes after. I've been setting a timer on my phone, or if I eat at work, I just it's easy not to drink after because I work in retail, and I can't always just run off the floor whenever there are customers in or whatever. So that's pretty much it. I just wanted to kind of go over the rules to remind myself, or if any of you have kind of are following now and are interested in what my surgeon says should work for everyone. If your surgeon isn't as hands-on, these are just great reminders always. So thank you guys and have a wonderful day.